Welcome to the video, Constructionism and Motivation. Client skills are always already present. My name is Dr. Stephen Bacon. I'm a clinical psychologist in Santa Barbara, California, and I've spent the past decade writing books and researching exactly how psychotherapy works. The alternative change paradigm. Up to this point, we have argued that the primary model underlying constructionist therapeutic change is the one proposed by Jerome Frank. Therapeutic change consists of a ritual with two parts, an explanation for the presenting problem plus a prescribed action. The assumption is that the action, when completed, is curative. The difference between the constructionist view of Jerome Frank and the standard view is, of course, that neither the explanation or the action have inherent power. They are simply constructions. Hence, the intervention is a ritual, not a scientific procedure. There's a second model of change implicitly or explicitly endorsed by virtually all therapists because it is so common sense. It is usually called behavioral or systemic and consists of the idea that when external rewards or punishments are increased, behaviors, attitudes, and feelings change. Examples of this are token economies in prisons, milieu therapy and treatment, group therapy, increase or decrease in financial support from parents, and threats of divorce for infidelity or substance abuse. A constructionist approach to rewards and punishments. Just as constructionists see the Jerome Frank theory differently than standard therapists, they also view these behavioral systemic effects differently than standard therapists. The main difference is that constructionists see most clients as already possessing the skills to resolve their issues. At present, they are simply choosing, consciously or unconsciously, not to use these skills. The behavioral interventions increase client motivation to use the skills they already possess. In that sense, sufficient motivation uncovers the actual skill level. Given that many standard therapists use a skills deficit model and spend lots of time teaching skills, it's provocative and radically confrontive to argue that they are completely missing the level of existing client skills. Examples of extant skills. This presence of skills, lack of motivation to use them, is easily demonstrated by common life examples. Dissatisfied wives who report that their husbands are unromantic and have no capacity to share or understand feelings are often dismayed when the newly divorced ex-husband is both romantic and good at feelings with a new partner. Teens who seem bereft of communication skills or the ability to delay gratification in the context of their parents show excellent communication skills in group therapy and often recommend the benefits of delayed gratification to their peers. New adults who seem immature, addicted to partying, and disinterested in career development develop a kind of instant maturity when the girlfriend gets pregnant. They marry, get a good job or finish school, and renounce immature behaviors. Behavioral genetics and skills. Recall that the latest behavioral genetics research has used multivariate analysis to demonstrate that there are actually only 3 different psychiatric diagnoses: regulation of depression, anxiety, acting out, for example, sociopathy, anger issues, substance abuse, and reality issues, like psychosis or bipolar. Socializing children includes imparting skills to deal with each problem category. For example, almost all children are taught to regulate affect, to control the urge to act out against others, and most importantly for social constructionists, to learn how to see reality in the same manner as other cultural members. In sum, except in the case of radically impoverished parenting, clients enter adulthood with significant skills in terms of moderating the 3 primary psychiatric problems. The social argument. The experience of heroin addicts returning from the Vietnam War offers another angle on the social and cultural aspects of motivation theory. Heroin addiction in the 1970s was a significant substance abuse issue, with recovery rates averaging below 20%. Many soldiers in Vietnam became addicted to heroin, and significantly, it was both more pure and more powerful than the heroin available stateside. When these soldiers returned to the States, more than 90% of them recovered from their addiction. The reasoning behind this positive recovery rate is that the returning veterans had good prospects in terms of work and marriage, and they controlled their substance use in order to profit from their opportunities. Put another way, the vets already had recovery skills. They decided to use them because there would be a big payoff. Conversely, the heroin addicts in country were primarily in the ghetto. They weren't going to get a big reward for recovering from their self-destructive drug use. The no inherent power in techniques argument. The no inherent power in techniques finding implicitly proves that the clients already possess the skills needed for change and for controlling poor behaviors and feelings. If they didn't have the skills already, then teaching them skills would make a difference, and techniques would have inherent power. For example, if a person doesn't know how to drive a car, imparting driving skills has inherent power. If everyone already knows how to drive, teaching them to drive fails to enhance outcomes. In this situation, searching for the reason that they are acting like they can't drive will be a more fruitful strategy. For example, if one learns that they act like they can't drive because they are lazy, or because they believe that if they drive they will have to do endless errands, these factors can be the focus instead of teaching driving skills. Significant others and motivation. Working with significant others to enhance motivation is one of the most important parts of constructionist motivation theory. Examples include parents setting appropriate boundaries, spouses communicating therapeutic threats, and urging a client to join a healthy group with a positive set of values. While most therapists recognize these factors, they are relatively slow to use them, often preferring the safer route of teaching skills or exploring traumas. Moreover, a number of schools of therapy discourage contacting significant others, worried that such contact may violate confidentiality and lead to a diminishment of therapist-client trust. While most therapists have had some experience of problems with trust issues, the risk of these problems is small compared to the potential increase in motivation arising from contacting significant others. Of course, it should be done carefully and ethically in order to minimize trust issues, but the constructionist who understands that motivation is much more important than skills training can usually find a way. Behavioral genetics and long-term strategies. While working with significant others is an important part of constructionist motivation theory, it barely scratches the surface in terms of the therapeutic possibilities. More specifically, we need to begin by examining one of the most basic assumptions in psychotherapy, the long-term strategy argument. One of the most striking findings from the new behavioral genetics is the inability of major environmental factors, such as schools and family, to have a long-term effect on functioning. This is well illustrated with the example of weight gain. Adult children that are adopted have no correlation with the weight of their adoptive parents, and a significant correlation with the weight of their genetic parents. This shows that food strategies learned in their adoptive family, whether positive or negative, have no long-term effects on weight. Once they leave the family, the functioning returns to their genetic norm. The behavioral geneticists see the same effect with good or bad life strategies from schools or families. When you're in the good environment, you get a temporary bump up. If you're in a bad environment, you get a temporary bump down. After leaving that environment, you regress to your genetic mean. The false promise of fixing maladaptive patterns. These genetic studies essentially refute the idea that there are long-term negative effects of environment. This finding belies the primary strategies used by many psychotherapeutic schools when they argue that we should focus on remediating traumas, patterns of maladaptive strategies, and dysfunctional schemas. They believe that if these problematic patterns are replaced with healthier strategies and better ways of thinking, there will be a long-term benefit. Genetic responds, sorry, the only internal long-term effect comes from genetics, not from maladaptive strategies. The environment only has long-term effects due to structure, an external factor. For example, being rich or poor, or being white or a person of color. From a psychotherapy point of view, these findings suggest that teaching skills fails to result in long-term client gains. Moreover, it implies that skills are not the reason for client improvement. If they were, then clients would be permanently changed by them. For example, if you resolved your anxiety or depression problems with skills, you would have a permanent improvement in your issue over time, given that you now know how to rid yourself of very painful symptoms. However, since we know that learning those skills didn't make any long-term difference, even though the skills when employed actually reduce anxiety, we can surmise that the problem wasn't a dearth of skills. It was a dearth of motivation to use the skills. The confusing nature of client attribution. Clients, however, are enamored of the maladaptive strategy trauma resolution models and often report that learning new skills, new life strategies, and resolving traumas are responsible for their improvements. This is the essence of the constructionist argument. Whatever one believes to be true becomes true in constructed reality. A brief comparison of the improvement in anxiety via psychodynamic versus behavioral interventions illustrates the point. A psychodynamic client relieves anxiety via revisiting key moments in the past and working through the associated feelings. The CBT client learns new skills, or perhaps practices exposure therapy and never examines the past. The dynamic therapist sometimes argues that no real and permanent change is possible without resolving the past. Conversely, the behaviorist touts the benefits of the newly learned skills. The constructionist sees both interventions as rituals and sees both approaches as techniques that lack inherent power. The actual power here is the client belief that doing the prescribed action, working through feelings, or practicing anxiety reduction skills will make them better. Of course, one client attributes their improvement to resolving trauma and the other to using new skills. That's what they have been taught to believe. In this case, the client opinion about the source of their improvement is simply an extension of the ritual designed for them. If they believed in exercising spirits, they would attribute their improvement to the fact that the spirits are gone. The benefits of new skills. This doesn't imply that the new skills that therapists teach clients aren't helpful or aren't new. They are helpful, and many clients have never heard of those skills before. But if you already have sufficient skills to accomplish a task, learning new ones won't have a measurable impact. You've simply gone from competent to equally competent. Take controlling anxiety as an example. Think of the skills that most parents teach their children. It's going to be okay. Let me give you a hug. Think of something else. Distract yourself with something you like. Go play, move your body, and you'll feel better. You're not alone. These and similar tools are available to the vast majority of socialized individuals. Adding a few new ones isn't going to make much difference. The result of therapy for anxiety, whether psychodynamic or CBT, is the granting of permission to use the tools they already have. Sure, they may add a few new ones, but it's the permission that's important. The power of the relationship. A client begins therapy with a presenting problem. Constructionist motivation theory states that they have the skills to resolve the problem. The skills are not in use because of negative motivators and secondary gains. Now, the client has a relationship with the therapist who is urging them to use their skills. For the functional 55%, the persuasive power of the relationship is sufficient to overpower the external motivators, and the client is free to employ their skills. Situation resolved. From this point of view, individual therapy works simply because we add the motivation derived from a relationship with a wise and caring therapist. Put another way, clients change because they are asked to change by a high-status person. Many therapists believe in the famous statement, "It's all about the relationship." The common factor group central argument is that the therapeutic relationship is the most important common factor. Indeed, some argue that it is the only common factor. Constructionist motivation theory explains exactly why the relationship is so central and so powerful. It also implies that enhancing outcomes requires strengthening the therapeutic alliance or multiplying its influence by using other motivators such as group therapy, significant others, and thoughtful employment of positive cultural factors. For example, membership in helpful groups like churches or athletic clubs, strengthening positive family connections, and working in a helpful milieu. Motivation theory and feelings. Up to this point, we have emphasized that motivation theory is defined by motivators and secondary gains. It tends to focus on the environment. However, this environmental focus also has important implications for feelings and affect. Therapists have long known that many feelings are more environmentally centered versus internally centered. Such feelings are generally called transactions and serve as communications with others. A simple example would be a husband who pouted about the weather on a Hawaiian vacation because he would rather be skiing. Transactional feelings are environmentally oriented, often appear to arise from self-interest, and seem shallow versus the deeper feelings that arise from the inside. Some therapists have argued that virtually all feelings have at a minimum a transactional component. Others are more radical and believe that all feelings are transactions, even when the individual believes they are generated internally and unconsciously. The constructionist is intrigued by the idea of emotions as transactions, given that transactional emotions are much more fluid and changeable than internally generated affect. Is it easier to change pouting on a Hawaiian vacation or to change a deep sense of unworthiness arising from poor parenting? The case for feelings as transactions. Perhaps the most compelling case for feelings as transactions comes from Ken Gergen and the relational constructionists. This group believes that the self exists in the space between the person and the other. In that sense, an individual has multiple selves, all of whom are relationally defined. From the standpoint of affect, all feelings occur in the context of the relational self. In other words, feelings always exist in the context of the other. There are no feelings that are purely generated from the inside without the context of relationship. Eastern thought proposes something similar, although with one important difference. Eastern thought believes that humans are drawn into unproductive strategy for achieving happiness, consisting of chasing desires and avoiding fears. They might argue that all feelings related to fear and desire are transactional with the environment and relationships. However, they also believe that there are productive feelings that arise internally that are connected with ideas like love, truth, service, compassion, and knowledge. Some family therapists have emphasized the transactional nature of feelings, and for example, given the assignment to replace statements such as, "I am angry," with, "I'm acting angry." They believe that the insights generated by seeing affect as transactional are transformatory. Finally, the behavioral geneticists believe that symptoms emerge when our underlying genetic vulnerability is exacerbated by negative environment. While many clients and therapists blame past traumas and missed learnings for an inability to cope with current environmental stress, the geneticists claim that the past is not the cause. Rather, the past traumas probably occurred as a result of genetic vulnerabilities. The current negative affect is the result of a dialogue between our genetic vulnerabilities, manifested as problematic feelings, and the stressful environment. This concept of dialogue is a different way to say that our feelings are transactions with the environment. The bias toward the internal. Although many therapists are familiar with these ideas about transactional affect, in practice this is an idea that has been systematically neglected. Clearly, one's entire environment has the potential to be motivating and operate as reinforcers and punishments. However, although virtually all therapists are trained to take careful histories, the quality of those histories is limited by a kind of default idea that inner feelings are more important than outer influences. Moreover, most of our psychological interventions are focused on inner processes. The old saying, if all I have is a hammer, everything looks like a nail, applies here. We tend to see client issues as due to problems in the past, with traumas and missed learnings, and minimize the effects of current environmental factors. In addition, it is somewhat insulting to infer that a client's feelings are due to externals. Believing that a wife is staying in an abusive marriage and professing love in order to sustain a comfortable lifestyle is a relatively disparaging explanation, versus postulating that she is accustomed to disrespect due to a history of harsh parenting. Is she a shallow opportunist in violation of healthy core values, or is she a damaged individual struggling to recover? Transactional feelings are Dionysian. Transactional affect is much easier to change versus internally generated affect. The realization that I've been pouting on vacation because I didn't get my way about skiing leads to relatively easy change. Conversely, the concept of my Hawaiian pouting is due to the fact that I have been taught from childhood that I'm not allowed to enjoy myself leads to relatively difficult change. Feelings that are seen as a way to influence or communicate with others are much easier to change than feelings that seem to arise from the depth of my being. In addition, I don't identify with feelings as transactions nearly as much as I identify with inner feelings. I am an anxious person refers to identifying with inner feelings. Conversely, I can get too angry when I encounter injustice refers to a transactional and relational stance in certain environments that I can control relatively easily. Inner feelings are Apollonian and tend to stabilize the self. Transactional feelings are Dionysian and lead to relatively effortless change. A feeling that is primarily a communication is as easy to change as my last text. A feeling that arises from within seems as if it is set in concrete. The Happy Marriage of Motivation Theory with Jerome Frank. Motivation theory by itself is helpful in terms of enhancing outcomes by increasing motivating factors from the environment and by helping therapists reveal skills instead of teach them. But the most important contribution of motivation theory has to do with how much more fluid it makes psychotherapeutic reality and how much easier and more powerful it makes therapeutic rituals. Motivation theory creates a new sense of just how constructed reality is and how easily a client can change. You know that most clients are predisposed to change simply when asked and when offered a credible rationale. You understand that most of their problematic feelings are transactions and relatively fluid and malleable. You see your client is always already possessing the necessary skills to change. These skills simply need to be released from their current bind. Moreover, their problematic feelings are not due to a long-term strategy. Finally, if necessary, you are free to enhance their motivation by including significant others or asking them to participate in a mini culture, like group therapy or milieu therapy. The optimistic therapist. The accumulation of these positive factors gives the therapist a background sense of optimism and unlimited possibilities. This carries through to the design of the rituals that are the basis of client interventions. You know that things are not as they appear. Certainly your client is convinced that they are facing a relatively dire situation. You understand that the entire situation is much more mobile than they believe. Paul Václavic popularized the Eastern European saying, "The situation is hopeless but not serious." Constructionists have compassion and understanding for the apparent hopelessness of the client predicament, while reserving the option to simultaneously see it as not serious. The Apollonian Rebuttals. Question: Motivation theory, and indeed your version of constructionism, seems quite hierarchical, with the therapist as expert and the client having a limited and circumscribed role in their own healing. We prefer a therapeutic relationship that is more empowering for the client. Answer: It's correct to assume that constructionism has some inherent hierarchy built into its basic theory. Constructionism assumes that many people mistake what is constructed for what is real, and due to this confusion, increase their own suffering. The one who can discern between the two is necessarily more advanced than the one who typically confuses the two. That said, motivation theory clearly sees the client as more powerful than standard psychotherapists. Simply assuming that the client is always already skillful is a remarkably empowering stance. More importantly, the constructionist is keenly aware of the relationship in the therapeutic alliance. Anything that strengthens that alliance positively affects outcome. Understanding this principle, the constructionist consistently structures therapeutic rituals to empower the client, and whenever possible, sets up situations where the client takes the lead, or at a minimum, actively co-creates the therapeutic relationship and interventions. Transactional theory cheapens life. Question: Seeing most or all feelings as transaction cheapens the concept of being human. If every feeling I have, whether sad or idealistic, is simply some shallow attempt to move ahead in life, then it reduces life to commercial enterprise, devoid of meaning. Is every symphony and work of art a transaction? Is every loss simply a self-centered plea for sympathy? I don't think so. Answer: While the relational self as conceptualized by Gergen and his colleagues sees all feelings as transactional, that does not imply that they are all self-centered, shallow, or manipulative. A mother's feelings are certainly transactions with her child, yet no one would argue that the bulk of such transactions are mediocre, without meaning, and devoid of authenticity. That said, the Eastern concept of linking problematic emotions to fear and desire offers a relatively easy way of discerning between unhelpful affect and feelings that have the capacity to move one forward. While clients often argue that their fears or desires are deep-seated and unbudgeable, it is useful for the constructionist to conceptualize them as relatively transitory and malleable. Trauma as an Apollonian concept. Question: Trauma is a real thing. It not only causes psychological scarring, but there are negative physical correlates as well. How can motivation theory be so dismissive of the power of trauma? Moreover, it appears that constructionism makes light of human suffering. Answer: Constructionism parallels Buddhism in that it recognizes and has compassion for human suffering, but diverges from standard psychotherapy when it comes to assumptions about the cause of suffering. In truth, most psychological systems dispute the client's explanation for suffering. For example, CBT teaches that hidden misconstruals are the source of suffering, and humanistic psychologists look for signs of inauthenticity to explain life problems. Constructionism differs from standard explanations in that it sees all of these confident therapeutic explanations as just as constructed as the extant client explanations. This, of course, creates a more fluid and malleable therapeutic milieu. Just as constructionists believe in suffering, they also believe in trauma. No one who has worked with clients could possibly argue that the feelings resulting from being raped or watching your loved ones die are simply misconstruals arising from wrong thinking. But recovery from trauma necessarily requires adopting a more functional attitude toward the traumatic memories. Every standard trauma treatment urges clients to depersonalize the memories, or to abandon the feeling that they are unique in their suffering, or ask them to consider what they have learned from their experience. It's certainly true that things like trauma leave a mark. For example, a person who was raped in a stairwell might experience flashbacks and panic attacks when entering a similar stairwell, even years later. This makes perfect sense. From an evolutionary point of view, it is valuable to associate feelings of anxiety with highly threatening experiences. But these kinds of experiences and connections, while common, are valued and reinforced differently by Apollonians and Dionysians. Apollonians use them to stabilize identities, typically as recovering victims. Constructionists can be full of compassion and understanding, but still discuss the traumas as transient events and emphasize individual resilience and fortitude. Obviously, this kind of emphasis must be done carefully and kindly to avoid re-traumatizing the client, and in certain cases, it is necessary to support a temporary victim identity, but the overall focus remains Dionysian. Summary: Constructionist motivation theory, with its focus on the environment, adds an enormous set of options to the constructionist approach. Obviously, it can be helpful to enhance motivation by working with significant others, but that merely skims the surface of the possible positive outcomes. The most important contribution is the way the motivation theory helps make the therapeutic milieu more fluid. Seeing feelings as malleable transactions, recognizing that skills training is largely unnecessary, except as part of a ritual, feeling free to dispense with the concept of long-term maladaptive strategies and deeply ingrained patterns. All of these factors make large positive contributions to the fluidity of the milieu. One of the issues with constructionism is that it can be amorphous. What does one actually do differently as a constructionist? Motivation theory gives pragmatic, usable responses to that question. The relativity problem. Fluidity is indeed the hallmark of constructionism. It is its particular strength and its particular contribution. Unfortunately, this strength also harbors a weakness. The most telling and common critique of constructionism is that it can be accused of relativity and of negating or ignoring virtually all meaningful values and ideals. This is a particular problem for the healing professions. Without a solid sense of ideals and goals, how can one determine what is truly healthy? Without a sense of where north lies, how can a healer give any guidance? These are significant critiques and questions. The next video focuses on providing some answers.